Welcome everybody to this webinar on motivational interviewing and how we can apply this technique to diabetes self-management and prevention. We're going to talk about these interviews, the principles behind it, how we prevent, and how we can help patients to prevent diabetes, or those who already have it, how they can get control of this condition. In this slide here, we can see the learning objectives for this afternoon's session. We want to increase the awareness about the principles and the basic strategies behind motivational interviewing so that we can understand the different barriers that patients face when they try to get when they're trying to access medical attention. We also want to improve our understanding of how to apply the steps behind motivational interviewing in order to prevent and control prediabetes and diabetes. And lastly, we're going to practice some of these technical abilities that we're going to share with you. These are facilitation abilities or facilitation skills through a game. So before we get started, we want to start with a poll. Two very easy questions. The first question is, have you ever used motivational interviewing before? At some point, answers are yes, no, or I don't know. You'll see those when the poll launches. There we go. So question one, have you used motivational interviews before? Yes, no, or I don't know. You can always answer through the chat box if you prefer. The second question asks whether you are familiarized with the National Diabetes Prevention Program. That's a DPP, Diabetes Prevention Program. So again, the answers are yes, no, or I don't know. Well, from the answers that we've received, we've seen that over 50% of you have used motivational interviews before. That's great. Some of you have not, which is fine. Some of you don't know what motivational interviews are, but that's fine. So a little bit more than half of you are not familiar with. Also, for question two, we see that about a little more than half of you are not familiarized with the diabetes prevention program. So we're going to give you some information about both the motivational interviews and also the DPP. And of course, you can always contact NCFH in order to learn more about both of these. So thanks for answering the poll. We appreciate your responses. So now we can go on to the next slide. So let's begin by talking about motivational interviews. What are these? We have some visual concepts here. So the motivational interview is designed to meet certain objectives that are going to strengthen the commitment and the motivation in people in order to create a specific change in their behavior. We do this through exploration. We explore what are the reasons that the patient may have to modify their behavior, maybe to help prevent a certain condition or to manage a condition, or maybe just simply to improve their lifestyle. Also, motivational interviews are a technique in which the therapist or counselor can become a collaborator in the patient's change process. This person will create a relationship with the patient, and it's going to help to promote these changes in behavior that's going to improve the patient's health. And we do this through empathy and through kindness. So the motivational interview is based on 4 different elements. And each of these 4 basic elements have sub-elements that the therapists or counselors need to follow in order for this to be beneficial to the patient. I'm going to speak with you about these 4 main elements. First, we have collaboration. Secondly is acceptance, compassion, and evocation. So let's talk a little bit about collaboration. This element references the type of relationship that we try to establish between therapist and patient. Remember that collaboration has to be active among both experts. And I'm talking about the therapist taking on the role of being an expert in the use of the tools that are available to the patient to overcome obstacles. And also, the patient is also an expert. The patient is an expert in his or her own life. This is the person who's going to explain, yeah, what the barriers might be, what stage of life the patient is in, so that we can then combine both of these expertises in order to create a real motivational interview, and we can reach a conclusion about what is the, the, the behavior that needs to be changed in order to help prevent or manage prediabetes or diabetes. Secondly, acceptance. Acceptance is an attitude that the therapists need to develop. And we do this by meeting four different conditions. It's we must recognize each person's inherent value. Every person is a unique human being, and we're all distinct. Every person, you compare them to everybody else. Everybody is distinct, is different. So we can't apply a one size fits all approach to everybody. Also, there must be empathy. We need to develop real interest in understanding the patient's perspective, how the patient looks at life, and how this perspective influences life. How about autonomy? Being able to respect each person's own right to be masters of their own life. So as a therapist or as a counselor, we cannot control the patient's life. And lastly, affirmation. This is recognizing the strengths and the efforts that are being put out by the patients in order to try to realize a change. So that's what, all of these make up acceptance. Then compassion. This means actively promoting uh, other people's well-being. We want to prioritize their needs. We know that not everybody who has pre-diabetes or diabetes uh, has the same needs. Everybody may have different needs. Every person is it's an individual with their own situation, and we may need different uh, a different approach. And lastly, evocation. We need to promote the creation of ideas and thoughts and opinions inside of the patient. So it doesn't matter what the therapist's opinions might be. We have to offer whatever is best for the patient. And of course, what we also need to point out what is needed. Uh, we need to promote the strengths and the resources that the patient has, and also to manifest these skills so that the patient can carry out, can realize a change. So moving on to the next slide, here we have the clinical principles of the motivational interview. This is where everything is developed, where this interview is developed. This has five basic principles and skills that the therapists and counselors must have during their intervention. I will explain each one of these, and I'm going to make some recommendations, starting from these principles. And I'm also going to present some case studies just as examples. These five principles are resistance, avoiding arguing, empathy, discrepancy, and empowerment. Let's go to the next slide. First, let's look at resistance. Working on resistance during this motivational interview is an important interview. It's an important element because we want to keep the patient's level of resistance to come up. We know that sometimes people will come to us and they are resistant to change. They're not open to ideas. They say that everything's fine and that they don't need to change anything. So it's important for us to identify what they're resisting, and then we take them, by the hand, step by step, one step at a time. Resisting is a normal part of the change process, and we need to be able to share this with the patient. Also, it's important to realize that resistance could be a source of information about the patient's past experiences. So this creates context. Uh, Understanding their resistance points is going to help us as counselors, as therapists, to be able to know more about the patient, to understand those barriers and to understand why the patient is resisting change. The therapist needs to take advantage of that moment, uh, to be able to really understand and create the most beneficial situation possible by understanding the resistance and maybe providing a new perspective so that the patient may be more open to creating or accepting a different thought process. This way they might be able to think, well, maybe there is a way for me to change the way that I deal with my disease, with my situation. So some recommendations for the interviewer is don't offer any potential solutions. Don't tell them what they need to do. You may suggest certain points of view, and what we're looking for is that the patient gets involved in this active process of thinking, of creating solutions to problems. And this is something that we're going to work with the patient with. So don't try to impose new points of view, uh, or new objectives. So let's say you placed certain objectives on the table. We're going to eat healthier. We're going to do a little more exercise. So during that process, maybe the patient's still resisting. Maybe the patient doesn't feel that the patient can realize this change, but we need to be able to point back to those objectives. And lastly, we need to offer new information, alternatives, strategies. We're not going to try to impose our will, but we're going to give them the information and encourage them to reach a point of reflection to where they might think, okay, you know what, I'm open to this and I'm learning new information so that I know that I can do something. So I know that we have a very simple example here on the text box to the right. We have a patient, her name is Maria, and she says, I simply don't think it's so important. My uncles and my aunts, they have diabetes and they're doing okay. So I'm not going to try to do any of these changes. I'm not going to try to put my whole family through these changes. So that maybe you as the therapist, maybe you can tell Maria, hey, Maria, can I tell you what worries me? So you're not telling her, Maria, you have to do this, you have to make these changes, or here you need to take up these new skills. No, how about, hey, look, can I share with you what I'm worried about? What can I share with you? What why it bothers me? Why this resistance? How I see this may be affecting. Remember, we have to be able to be empathetic. We need to have the ability to take them to a moment where they can reach some reflection. So now let's go on to the next slide. Let's talk about avoiding arguments. Going back to the prior principle, the objective of increasing awareness of the problem. We need to do this. This is important because this is going to help the therapist to avoid any type of argument with the patient. We need to, we need to avoid any type of confrontation or argument, because sometimes insisting on a point uh, with the patient is only going to cause the patient to, to build up their walls and to really double down on their own, prior opinions. So what's going to happen is that this person is not going to want to continue. They're not going to want to be even want to be open. They won't even want to be open to the possibility of change. So what we need to realize here is that the patient's resistance may be a signal that the strategies that we'll talk about later, that the strategy should be reconsidered. Maybe we should look for other, come up with other strategies rather than the ones we were already starting with or thinking about. So let's create different strategies so that the patient may reconsider or at least lower their level of resistance, or maybe just feel a little more comfortable with a behavior process, with a behavior change process. We need to be able to work meeting them where they are. We know that this person is going to be there. There are different stages. This person may just be realizing that they have a problem. Then the following stage would be to accept the problem itself and realizing that they identifying it and looking for strategies or looking for help. Then, okay, so I've accepted it. Then I need, what are the actions that I need to take in order to create this behavioral change that is going to help me to manage my diabetes or to prevent diabetes? And then how do I continue with this process? So it is important for the counselor or therapist to understand at what stage in the change process the patient may be. We need to avoid any type of posturing to defend our own points of view. As counselors and therapists, we may have our own ideas, our own perspective about health, but it's important that we, take off the the counselor or therapist cap and share the same perspective as the patient. At last, we need to increase the awareness of the problems. So we need to realize that we need to help them understand that there are problems and that something needs to be done. Something, okay, here is this diabetes or this pre-diabetes, and if certain things don't change, this might turn into this other condition. So we need to work with them little by little. And if you have a lot of barriers up right now, if there's, if you don't want to exercise, if it's too hard to change your eating habits, then we can maybe start with by recommending smaller steps, maybe adding some vegetables to your food, maybe starting with 5 minutes of exercise. Everything is a process that we take step by step. We have another example here on the right. Here we have Juan. Juan says, I'm tired of trying all of this and nothing changes. I'm just going to do what I want. I'm going to eat what I want, and I'm going to continue to fail. So then as a therapist, we tell Juan, hey, you're not failing. It takes time for us to reach this objective, this goal that we as a team have drawn. But if you will allow me, I can help support you, can help you get there. So this is a way to show acceptance. This is a way to reach that acceptance that there is a need for change, and we need to be able to affirm that this person, yes, is having issues or problems, but look, just take my hand. I'm going to continue to support you, and I'm going to help you. And he did it without arguing in any way. So if we go to the following slide, this third principle is empathy. In this case, the interviewer always has to show respect and tolerance towards the differences that the patient may have. As I said, we might have our own opinions, and the patient will have his or her own opinions, and we need to be able to look at that and honor the fact that they have their own opinions. How do we express empathy? Being comprehensive, not judging the patient, or not judging the person's value as a human, and also not judging the value of the patient's perspective and how their life experiences may have influenced or has influenced their behaviors, perhaps related to the disease itself. So the recommendations we have for you is to always respond to the patient's viewpoints in a courteous way. Accept the fact that the person may be undecisive. Accept their ambivalence. This is part of the human experience. It's part of the decision and the change-making process. At some point, we've had doubts and we reach a point where we don't know what to do. And we see everything as an uphill battle. Changes are difficult. So it's important to accept and to recognize that being in this place is normal. Another recommendation is to consider that this person may look at themselves and see that they're self-blocked. They're looking at themselves going, I cannot do that. I can't change. It's hard for me to eat vegetables. It's hard for me to go to therapy. I don't want, I can't exercise or whatever it may be. So it's important that the therapist or counselor helps the decision-making process, and then we discuss or we talk about the possible consequences in a very empathetic manner. Also, acceptance of the patient is going to facilitate a change in behavior. When the patient knows that we accept the patient, he or she is going uh, to feel more open to changing. So here we have another example. In this example, we have Linda. Linda says, I just simply don't know whether I can do all of this. If we're looking at this process of changing, it maybe she's scared. Linda maybe just scared of changing. So it's important to point out that light at the end of at the end of the tunnel. So we need to be able to tell Linda, look, Linda, you seem worried about everything that they're asking you, that you're being asked to change. What is it that worries you the most? Look, we'll be able to get through this. We're not saying that all of this is going to be easy, but all we are doing is just asking, hey, what is it that worries you the most? This open question is going to help us show that empathy, and it's going to help Linda open up and express her worries to us. And this way you can have an easier way of knowing how to take the patient forward step by step. So let's go to the second to last slide, discrepancy. What are we talking about? Creating the discrepancy in the patient's mind, a difference between where the patient is now and where he wants to be. So at the point where the patient gets to your consultation and says, I can't control the diabetes, he says that he can't control what he eats, she may have some other example. You can always say, well, look, these are the circumstances that you have at this time. Let's make a plan. And let's try to imagine what it is that you want to see happen at the end of this process. What do you want to see happen 3 months from now, 6 months from now, a year from now? So what are these different scenarios? See, so the objectives that we're going to work on with this person are going to be very important, and they have to be clear. When those objectives have to be clear and understood. But it might be, hey, you need to eat some vegetable with every meal. Maybe from now to 6 months from now, you're going to increase your physical activity from where you are now, increase it by 30 minutes a day, or from 30 minutes to an hour, or whatever these clear objectives are going to be, and the patient has to understand them, agree to them, and we need to walk them step by step as to how this is going to be accomplished. This may help to create the patient's perspective without feeling pressured. This is a process the patient, where the patient may stumble halfway through, and that's valid, has to be accepted. But we need to be able to identify then what are those barriers and those speed bumps that they're seeing at the middle of the road, or halfway through the process, and then be able to move forward from there. So some of the recommendations for the interviewer or therapist is to create that difference, that discrepancy in the patient's mind between where he is and where she wants to be. We need to be able to show proof, evidence that the person can, that this patient can overcome the difficulties. And we have to be able to communicate this to the patient. It's also important to to be able to help the patient recognize where she is and where she wants to go in relation to her behavior. And the patient needs to be able to express his or her own reasons for changing. So remember, we need to validate all of those emotions. Yes, what you're feeling is valid. It's normal. Yes, from the very beginning, we need to tell them, hey, look, this is not the word, this process is not going to be a straight line. It's a process, and I'm going to help you continue to move forward step by step so that you can help to make that change in that habit or in that behavior. So yes, the patient needs to be able to present his or her own reasons. They need to be able to think about what their own barriers are, what those obstacles are, but they need to be able to see their own reason for their objectives. Where does the patient want to go? And the patient needs to be able to communicate to you what are her reasons? Why does she want to change? Why does she want to live a healthier life? Why does she want to live a longer life? Why does she not want to be, resistant to insulin? Why does she want to get rid of her diabetes? So the why is important. It's important in this process for you to start that conversation, to open that dialogue with the patient so that they can communicate with you as well. So now we have another example. It's Mario. Mario says, I don't have time to eat healthy meals because I have several jobs. It's easier to just grab a donut or eat fast food. So the therapist might say, no, may ask, how could it, what do you think could be different if we were talking about ways in which I could help you find ways to find other options to have healthier meals? So you see, this question is an open question. We recognize, look, we know we have you. I know that you have little time, that you're working multiple jobs, that it's fast and easy to just grab fast food. But hey, what if I could help you come up with ways to be able to choose healthier meals? What if we were able to work on a menu? If we were able to look for other alternatives? Maybe you cook at home. Maybe you have your meals fixed at home, and you can bring them to work so that they can be healthier. What are the different options? Maybe what are the options in the fast food restaurant? Stuff that the items that you could choose that maybe are less calories or less sugar or less carbohydrates, or, looking for options. Lastly, what we have is self-efficacy or empowerment. So empowerment, the principle of empowerment means being able to have confidence in oneself to face a task or a challenge. This is going to help the person to feel confidence in their own abilities so that they can feel sure and empowered that they will be able to carry out that action. So the emphasis behind this principle is it lies in personal responsibility. The patient has to have the responsibility that the therapist or counselor cannot assume. The patient not only can realize that change, but must realize that change. They have to be able to understand that nobody else can make that change for them. So the motivational interview has to address hope that you can change. We're not going to we cannot tell me, look, trust me that you're going to be able to do this, because the patient must have active control. We cannot how can we say this, we cannot override what the patient wants. We cannot do things for the patient. The patient has to do things for herself or for himself. So some of the things that you should tell the patient is, hey, I trust you. Of course you can do it. Of course you can overcome that. Of course you can achieve that. If you wish, I can work with you so that you can reach your goals, so that you can create the changes that you want to see. You'll see that in this way, The therapist is not at the center of this. It is all about, look, you can do this. If you want, I can help you, but you are the one that can do this. So in this way, we highlight the patient's own responsibility, that need for change. And we do that also through we also use, positive thoughts. This is going to help them and yeah, feel more empowered to do this. And the recommendations that we will give you behind this principle are that, if you need to once again create a new frame of reference for those negative experiences that this patient may have had with their difficulties, we can help them to we can help them to take those barriers and obstacles and not see them as failures. We're going to favor the point of view that shows that these obstacles are a normal part of the process of change. And we need to reinforce those positive thoughts. And some of the recommendations that we offer you uh, is the following, and the last recommendation that we'll offer you is to offer different types of therapy, different techniques, different strategies that can help the patient to see different options. They can see different possibilities to be able to master those changes in their behaviors and to be able to see these things through a different perspective and to help them go step by step through each of these stages. And here's the last example. And this is where the therapist tells Carmen, "Uh, Carmen, it's great to see how your glucose, your level, how your blood sugar level has come down since the last time we spoke. Tell me about the things that you're doing that are helping you be successful." So what we see here is the therapist reinforcing the effort and the success that Carmen has had to be able to lower that blood glucose level or to maintain it since the last time that they saw each other. So here the therapist asks to be told, "Hey, Carmen, what have you done? What have you done that has helped you be successful like this?" And so that way she takes that role and she's going to start reinforcing herself. Yes, I've started to exercise, or yes, I've started to take my medications regularly and on time. Yes, I've started to eat a little healthier. So this exercise shows us a way for the person to self-motivate by sharing those experiences that have brought her to some level of success. So this is the end of my part of the presentation. Now I'm going to give Maria the floor so she can tell you some more, so she can share some more information with you.
Gracias, Alexis.
Thank you, Alexis.
Muy interesante esa primera parte
So
de
this
la
first part of the
presentación.
presentation was
También
so
quisiera saber
interesting.
cómo podemos utilizar un
I
poquito
think we're
de
also
lo
interested
aprendido
in figuring out how we can apply what we've learned
la
so far.
prevención y control de diabetes,
Talking about the
la
prevention,
importancia de
the
usar
diabetes
este tipo
prevention.
de entrevista
So
motivacional
these motivational
en cuando estamos
interviews
trabajando
are
con
very important when we're
pacientes
talking
que tienen
with
prediabetes o
patients
diabetes.
who have either
Nos ayuda,
pre-diabetes or deep
nos
or
ayuda
diabetes.
a empoderar a
It
los,
helps us to
los entrenadores, o sea, a
empower the
ustedes que están
trainers, meaning
trabajando con
you,
el
the
paciente,
coaches,
a que
the
vengan
therapists who are
preparados
working with them, so that
dentro de los
you can
pacientes.
create or can
Esa
help to
tarea
evoke this change in the
compete
patients.
de ellos, pero ustedes
They
como
need to be able to come up with the
son
changes
los que
themselves, but
ayudan
as
a que
counselors
ese
and
cambio se
therapists,
dé.
we need to be
Ese
facilitators for
reconocimiento,
this change.
¿verdad?
And
Hay que revisar
that
las
recognition,
técnicas
when we use
que
when we
vamos
use the
a revisar
techniques
o
that
detallar a continuación
the
de la entrevista motivacional
the
y los
tactics there, the
criterios
techniques that we're going
motivadores
to
alimentan a los
see
participantes
here
de
going
tener
forward,
a
we see that
procesar argumentos para el cambio de tres diferentes formas.
this is
Se
going to help
exige
us
que el
create three different
participante
types of
utilice
arguments to create change.
sus propios
First,
argumentos, o
we need
sea,
to
sus
reach a point to where the
propias
participant
palabras
can
en
verbalize his or her
cómo quieren
own
hacer el
arguments.
cambio y
They need to be able to speak about how they want to
sus
change, what they
emociones,
want to
sus
feel, what are their emotions, what are
expectativas,
their perspectives,
expectativas
We also need to keep in mind the cultural
que pueden ser
aspects
muy
behind all of
diferentes
this.
según de
Uh,
cada persona.
Now, these can be very, these will be very
Además,
specific to
hay
each person.
preocupaciones y motivaciones, porque
Secondly, the participant needs
la
to
preocupación
express his or her
de uno
own
como
worries.
entrenador puede ser muy diferente a la
What
de
you're
las
feeling as a
otras
trainer
personas
or
que
as a
les
counselor or
toca
therapist could
el
be
proceso
very
de
different
diabetes o prediabetes.
from what this patient feels as they're going
La
through
motivación,
prediabetes or diabetes.
la motivación para el facilitador es ayudar
The,
al
the motivation,
paciente,
the, motiv- the
ayudar
moti- motivation
al
for the
paciente
facilitator, of course,
a
is to help the
que
patient,
controle su
to
diabetes
help
de
the patient reach a point to where they can control their diabetes without having
complicaciones.
major
Pero
complications.
¿sabe usted cuál es la motivación de la
But
persona?
do you know what this
En sí,
person's
puede
motivation
ser de
is?
familia.
Yeah, it may be
Puede
the
ser
patient's family.
ni su propia salud, sino
Maybe
que
it's not
intereses
even,
ajenos.
his own health.
Entonces,
Maybe it's
detectar
something
fácilmente
outside of himself.
a esas
So
personas.
these techniques will help us to
Igualmente,
identify these motivations.
utilización de
And
técnicas de
lastly,
facilitación
using
para hacer el
facilitation
cambio
techniques
es
to
ayudar a que
help
vamos a aprender, que
propel the
vamos a
change.
comenzar
And that's something that
a
we're
mejorar
going to
nuestra
talk about and
y
something we're
poder
going to
recomendar
start
que como grupos, como
practicing
organización,
today.
integren
We're
estas,
going to, and we are going to encourage you as organizations, as groups, that you take these techniques and that you implement them in your day-to-day life, because this is going to help you a lot.
el programa de prevención de diabetes,
So the Diabetes Prevention Program, or DPP,
ustedes
as we saw at the
otros
beginning,
no, o lo han
some of
oído.
you know what it is, have heard of it,
El Programa
and some
Nacional de
of you
Prevención de
have not.
Diabetes,
So
conocido por
the
sus siglas en
DPP
DPP,
is
es un
a
programa de cambio
program
de estilo de vida que está
based
basado en
on
evidencia
lifestyle changes
año
that
por
is
año.
that's an
Dura un año, está
evidence-based
basado
lifestyle change
y
program,
ayuda a los pacientes con prediabetes o con riesgo
which has
de
shown over a one-year
prediabetes
period that
y
it helps
todos
patients with
podemos reducir
prediabetes
riesgo en
to
un
be helped to
58%
reduce
dirigido
the risk of
directamente a
developing type 2
estilo de vida.
diabetes and reducing the
Entonces,
risk.
esos
And it reduces
facilitadores o
this risk by
entrenadores
58%
pueden
with
ser
the help of a lifestyle coach.
trabajadores de la salud,
And,
promotores,
and
pueden
who are
ser
these lifestyle coaches? Could be
trabajadores del
the
servicio
community health
social,
workers, could be people who work in a community
enfermeros,
health center,
pueden
could be
ser
nurses,
farmacéuticos.
could be
Hay
pharmacists.
muchos tipos de
There are
personas que se inscriben
many
y
different
participan de este
types of
programa
people
porque no se
who
requiere ningún
can be
tipo
part of the program because you
de
don't need to,
certificado para
because
participación.
no certificate, there's no requirement for a
Y el
certificate
deseo de
or
trabajar
for
con el
any
paciente.
specific type of training
El
to be able to
programa
help a
fue
patient do
muy,
this.
muy
The
efectivo.
program
Que
was
tan
very
efectivo
effective
que es cubierto por Medicaid, Medicare
to the point to
y
where that it
y
is
que
covered by
usted no
Medicare and
tiene
Medicaid by
copay.
100%.
Y
There is no copay.
los entrenadores de salud son educadores de
And
PACA
these
capacitados en poder, eh, en
and
poder
these lifestyle
aconsejar
coaches are
y, y, y dar
trained
educación y atención sobre
educators. They
diabetes
are
y guiar al paciente a través
community
del
health
programa
workers, and there are other specialists
todo para
who
que
deal
el
with
paciente
diabetes.
evite tener
And,
diabetes.
and we do this through the national DPP program so that the
La
patients
adaptación
can
de
help
la
to manage their diabetes or help prevent
entrevista
diabetes.
motivacional en,
So the motivational interview
en la prediabetes y en la diabetes es en general un conjunto de estrategias y una forma de
a
ser
set of
basada en
strategies,
evidencia
and
y está
it's a
centrada
set of strategies that is evidence-based. It
para
is
poder dirigir la
person-centered
resistencia de la
in
persona
order
al
to help
cambio
guide
o para
this person's
entender o
resistance to
deshacerse
change in
de
order to help
enfermedades. Se trata de
manage the
eliminar
prevention
barreras.
of of
Se
whatever
tiene que
illness or
llegar
disease they might
a
have.
un nivel de entendimiento
The
de
goal is to
identificación
create trust
de
in the
qué es lo que se
relationship
está
with the patient
qué
and
es
to
lo que
help
se
the
está
patient
tratando
identify their own
y de el deseo
internal
de
motivations
cambio
for
que debe
change
venir del paciente.
so that we can prevent or
Es el
control
trabajo
the
del
diabetes. It
entrevistador
has to come from within the patient, and
poder
it is the
hacer que el
interviewer's job
paciente es el que
to
quiera
see the
decidir
patient,
qué se está en la
to guide
persona.
the patient towards
¿Cómo se
wanting to do
genera
this.
eso? Con
So,
mucha paciencia.
how do we do this?
Ustedes saben las que
Very
personas que
patiently.
trabajan con gente
As you know,
diabético,
As many of you who have dealt with pre-diabetics or diabetics, this is something that you do little by little. You create a
Esa
relationship with a
relación
patient.
puede ser inmediata o
That
puede,
relationship could be
puede
sparked
tomar un poco de
immediately,
tiempo.
or it may take a while.
Y esas técnicas de motivación
And these motivational techniques
pueden ayudarle a generar esa
can
confianza
help to
y
create that trust,
involucramiento del paciente.
and can create the trust and the patient's involvement.
Vamos a cubrir un poco lo que son las técnicas básicas
So we're going to cover some of the
de la
basic
entrevista
techniques
motivacional.
of the
Están
motivational interview.
adaptadas para el programa de prevención de diabetes.
And in this case, they're already
Algunos de ustedes
adapted
tal vez ya
to the
estén muy conmigo
DPP.
lo que son las preguntas abiertas.
So have any of you,
Con
do you know
preguntas
what
abiertas
open questions
tenemos
are?
que invitar
With
a la
open questions,
persona
open questions are going to
a
invite
hacer
the
preguntas
patient,
de que
we're
no
going to
son
invite them to
cerradas,
reflect.
que no
It's
voy a
not
recibir un sí o un no.
closed answers or closed
Eso es
questions
lo
that
más
can only be
fácil,
answered with
porque a
or that
veces
can be
nosotros
answered with
tenemos
just a
poco
simple yes or
tiempo
no.
y esa es una de las cosas con las que tenemos
But rather they
que
stimulate verbal communication,
constantemente
and then they stimulate the
estudiar,
problem
¿verdad?
solving
Poco
and then
tiempo
how to
para
analyze the
trabajar con los
problem,
pacientes.
because we don't have a lot of time to work with
Tenemos a
patients.
veces hacer preguntas que sabemos que solo
So
van a
some
ser sí
so
o no,
sometimes we need to ask questions
pero
because we
ese
don't have a
tipo
lot of
de
time.
respuestas
The questions
no
that
se
can be answered
llegan
yes or no, but with those types of questions,
realidad
we
de la
cannot
situación
really
con la
get
que
to
ellos
the
han enfrentado y van a enfrentar.
reality of the situation that they're facing.
No nos deja saber más allá.
Those types of
Esa es una
questions
pregunta
don't
a
let
que
us
solo le
see
sabemos sí o
beyond
no, pero
that
no vamos
first
a hacer
encounter.
nada más.
They'll
Tenemos
be
que
able to tell us
estimular
yes or
el
no, but we won't
sistema
do anything more. So we need
emocional
to really
al
stimulate the
análisis de
the
problemas.
conversation
Porque
and the problem solving, the problem analysis.
yo sé que sí está teniendo problemas
So maybe you ask a question: are you having
la
issues
alimentación.
with
Me dijo, le pregunté que sí, que
with
estaba
your
teniendo
eating
dificultades o
habits?
que no.
And we can say yes.
¿Y qué hago después con esa
And yes, I know
información?
that they're having issues with their eating habits because they've told me that no, they're not eating
Ya
vegetables.
no
So
lleva
we understand that,
hortalizas.
we
Podemos
know that,
llegar
but we don't understand whatever's
a la
behind
razón
that,
principal
and
del
we cannot,
problema y por qué lo
with
está
just simple
teniendo
yes or
así.
no questions, we can't reach
Lo mismo son sus
really the
afirmaciones.
meat behind that.
Se reconocen las fortalezas
Same thing with
de la
affirmations.
persona.
In what
Hay que
we
darle
with
validez a
affirmations,
los
we
sentimientos y
recognize
a
the strength, the patient's
a la
strengths and
personalidad
resources.
de cada persona que puede ser muy diferente de uno a
We,
otro.
we
No
were able to
existe
recognize that everybody's reality might be a little bit different from one person to the
una
next.
métrica que sea igual para todos, ¿verdad?
That there isn't a way to
La
measure everybody
paciente
in the
se
same
ve a
simple
sí
way.
mismo
So the patient can see herself
desde una
from
perspectiva
with
diferente
affirmations, you
a la
can
que
help the patient
nosotros
look at
podemos
herself in a
pensar.
different, from a different perspective.
También tenemos que motivar con afirmaciones positivas
We also need to
para
motivate
que
with
se
positive
sienta mejor
affirmations
la persona y
so
sienta
that
que
the
puede hacer un cambio.
so that the patient can
No sienta
feel
todo el
better,
tiempo como
can feel
negativo,
that
¿verdad? De
he
que
or she
todo es
can
negativo
change.
y me han dicho que no
We
puedo
don't want
comer
everything
y
to
me han
be
dicho que
negative.
no puedo hacer esto
Because
y
sometimes they see that it's all
positivo.
negative. They've told me that I cannot eat
No
this.
les
They told me that I
ayuda
cannot do
nada
that.
positivo con lo
And
de lo que ellos se pueden
and they don't
agarrar
realize that there are
de lo
positive
que
things
ellos
that they
pueden
can
poco
look
a
at,
poco ir saliendo.
and
Recuerden
that there are
que el
positive ways for them
tratamiento de la
to
diabetes
step out of this
invisible
step by step.
es paso a
Remember
paso,
that
es
management and
paso
prevention of
pequeño,
prediabetes and diabetes
pero
is
duradero
is
y,
patiently, step
a
by
largo
step,
plazo.
and taking small
Tenemos
steps,
que
but
dar
that are
en
going to last a long
que se
time.
llama
This is a
que
process that's
pueden
going to be a
cambiar las
long-term
conductas
process.
no deseadas.
So they need to feel
Algunos
that
de
they are able
ustedes
to change
escuchan
those
reflectivo,
undesired
¿verdad?
behaviors.
¿Qué
Then we
queremos
need to
decir con
do a
escucha
reflective listening.
reflectiva? Que
What does
tenemos
that
que
mean? That
reflexionar,
means that we need to reflect, that we need to be
escuchar al
able to
paciente
attentively
y
and
reflexionar
actively
en eso que
listen to
está
the patient,
diciendo
to
con
reflect, what is the
reflexión.
patient
Tenemos que
really telling me?
responder. Si nos está
And I need
diciendo
to be able to
que no
respond
come,
reflexively.
sigo
See if
comiendo
the
lo
patient
mismo.
says, hey, you know what, look,
Si,
I'm eating the same as I
si
always have.
escuchamos eso y le decimos,
If we don't really listen to that,
ay,
and we
no sé
say,
qué le podemos decir,
oh, well,
pero
I don't know what we could tell
hay
them.
que saber escuchar
But we need to be able to listen, and we need to know
y
how to
reflexión sobre
respond positively
por qué no puede
and
cambiar.
reflectively.
Hay
And people
que
to
ir
reflect
en su
on
día y
why can't
analizar
you
qué es lo
change?
que hace para ver qué
I want to know
podemos
about your
mejorar.
day, and I want to know what you do to
Ahí estoy
so that we
escuchando
can
al paciente,
find
¿verdad?
something that we can
Entonces
change little by little.
no,
This way, I'm
no
listening.
pone de su
This
parte.
way, I'm listening to the patient, right? Instead of telling them, you know what, you're just not
Eh,
trying.
tenemos que resumir. Hay veces al
We need
final,
to be able
al
to
final
summarize.
de una
There are times
entrevista o de una
when,
hora de
at the end
intervención
of an
con el
interview
paciente, no
or
nos
a
tomamos el
session with a
tiempo al
patient,
final de hacer una
sometimes we
reflexión de
don't
todo lo que el
take the time
nos
to
ha
reflect on
pasado,
everything that the patient has said
eh,
to us,
que lo hemos escuchado, ¿verdad? Señora María,
to
yo
summarize, to show that
entiendo
we've
que
listened.
usted tiene muchas preguntas acerca
Senora
de
Maria, I know that you
nutrición.
have a lot of questions about
Déjeme
nutrition.
esto para poder ayudarle
Let
con
me
esta
give this
respuesta.
to you to help
Hacer
you
un
answer
resumen
your
de
questions.
qué es lo que más
Now,
le
being able
preocupa
to summarize
y anotarlo
what their biggest
y
worries
tratar de
are, identify
comunicarle
what
con
their biggest worries are,
comprensión,
and
¿verdad?
try to
Y
listen with
además
comprehension,
asegurarnos de
with
que cuando una
attention,
persona tiene
and
cosas
with interest, being really interested in this. When somebody is really worried about something,
preocupación, no le van
th-
a escuchar nada más
they're
de
not going
eso.
to listen to anything else
Entonces
until
es
they are able
importante
to solve
poder
that
ayudarle con esa
worry. So
situación.
it's important to be able to listen for that
Ofrecer
issue and
información.
solve that issue.
Eh, el
Lastly,
paciente le
offer
puede
information.
solicitar de
The
forma
patient
indirecta o
the
directa
patient may ask you for information directly or
siempre
indirectly.
sea de forma no personal o
So it's
trate de
important to
mantenerse,
give
eh,
advice that's not personal.
de no ser
So,
personal
taking
con
a
el
step back
paciente,
and
pero a la
not
vez
giving personal advice
siempre
to the patient,
empatía,
but at the same
¿verdad?
time,
Tener
having
cierto
empathy,
nivel
having a
de,
certain level
como
of,
hablamos, de confianza,
in the way
pero
that
esa
we talk,
confianza
uh,
se crea a raíz del
being able
trato
to create
y
trust.
del tiempo. Y
Trust
cómo
is
usted
created through
va
dialogue and with
confiablemente
time.
contestando todas sus preocupaciones.
And you have to
Entonces,
openly
considerar es
answer, listen to
importante
their questions so that at
aunque
some point we
siempre
can
teniendo en cuenta
respond to them.
esas
So
limitaciones de
we,
no volverlo
so we need to be
personal
able to listen and to
y
offer
necesita
information
empatía.
while at the same time not being personal.
Creo que podemos estar listos para practicar un poco
I think we're at a point to where we can practice a
el
little bit.
sendero de empoderamiento.
This
Este un
is
poco
the way to
historia de
empowerment.
este juego.
So I'll tell you about
Esta
the history
actividad que
of this
creamos
game.
junto con Access, que es
This
una
is an
asociación
activity that we started with
Association of
Access.
Diabetes
It's the
Care
Association of
Specialists.
Diabetes
Es una
Care
organización nacional
and
que
Educator
ustedes
Specialists.
probablemente ya todos han oído
It's an
hablar.
organization that maybe
Ellos
most
tienen
of you have
programas
heard of,
tanto de diabetes self-management, de
and
control
they
de
have a
diabetes,
diabetes
como
self-management
de
program
prevención.
and a
Este
prevention
es un
program.
juego que creamos para poder
And
ayudar a los
this is a game that we made up
participantes
to help the participants and the
y también a
facilitators,
todos ustedes que son
facilitators like
niños a
all of
poder
you,
practicar estas
to help
técnicas
practice these techniques,
de, de empoderamiento
these
que van a
empowering
ayudarlos a
techniques
ustedes a
that are going to help
reconocer la
you
forma
to recognize
en cómo están hablando
to
comunicándose
recognize
con el
the way
paciente y a la vez también
in which
poder
you are
desarrollar
talking with and helping the
bajo
patient.
lo que es el entrevistamiento, en la entrevista
And this
motivacional.
is all within the context of
El
motivational
propósito
interviewing.
del juego
The
es proporcionar
purpose
una forma
of the game
entretenida y atractiva para los
is
entrevistadores
to offer
que practiquen
a
las
fun and
habilidades
attractive way for
de
the
participación.
interviewers and the
Eh,
facilitators
la intención es
and
dejar que
trainers
ustedes se
to be able to
diviertan mientras
practice
están haciéndolo. Esto es algo que lo pueden
facilitation
hacer de
techniques and
forma
skills.
virtual o lo pueden hacer de
This is
forma
something that can be
presencial.
done virtually or
Hay
in person.
organizaciones que
There
tienen
are
acceso
organizations that have access that have the ability or have access to meeting in person, and they have training hours. And within their training hours, maybe you can include, 30 minutes to an hour of games, and you can practice your empowerment skills and facilitation skills. At the same time, you'll have fun, and you'll be able to participate in some group games, and it really helps quite a bit. The objective is to help strengthen your skills and your level of comprehension to be able to improve your self-care programs and to increase the level of success for the participants. So it, it's going to help us be better facilitators, and at the same time, that will help our patients reach the goal that they want to reach. The interviewers are going to be able to practice through different scenarios which have been created in a culturally relevant way for a Hispanic audience. The game is both in English and Spanish. This is culturally relevant for Hispanic or Latino communities and will help us to facilitate these changes. If you would like to volunteer to play today, if you want to play today, tell us via the chat or in the Q&A. Give me your name, give us your name, let us know you want to play. And we're going to take the first few volunteers so that you can play with us today. We're going to try to do this virtually. Our group today is bigger than this group today is bigger than the size of the group that you would probably work with your group of volunteers or in your health center when you're actually working. So go ahead and put your name in the chat box if you want to volunteer. Alexi is going to keep an eye on that. I'm going to go into the different scenarios. Each card has a scenario, and that scenario is going to fall under one of the different main categories. These categories correspond to categories in the DPP program. That's the diabetes prevention and diabetes prevention program. So the first is healthy eating, being active, and healthy coping. These three, as you know, can be used with pre-diabetic patients as well as with diabetic patients, as well as anybody else who suffers any sort of a chronic condition. So these categories are going to help with many different types of chronic illnesses, and these are going to help us in any of those cases. The technical skills for technical facilitation skills that we're going to work on right now are, one is subgroups, and I blew up the image so that you can identify the image with what it is, so that you can identify or correlate the image to the technique. So if we think subgroups, what are we thinking about? Okay, I have a group of 20 people. Right now, for example, I think there's 50 of us here on this call, on this webinar. And I'm going to split you up into groups of 5. Each group is going to have the same question, the same scenario, and you're going to discuss it. So we're going to break you up, and then we're going to come back into the big group That way we can discuss, share what each group thought about,
en resumida cuenta, ¿qué conclusión podemos llegar?
and then, what conclusions can we draw from there?
Cruzadas. Le pregunto a Pedro y después después que Pedro me contesta, le pido a María que le agregue, ¿verdad?
So cross questions. Maybe. Okay, preguntas cruzadas. It sounds like cross questions, and that means I ask Pedro something, and Pedro might ask a related question to Maria, and the questions kind of go from one person to the next. So ping pong, what is that? I ask Juan a question, and then Juan asks me a question, and then I ask him back.
Y así vamos pudiendo involucrar y creciendo en lo que es la conversación.
In this way, we can continue to grow in the conversation. The next concept is the carousel. And the carousel would just go from one question to the next, to the next, to the next. And we go around in circles. Then next we have open questions and affirmations. Which one do you think is open questions? It's the red one with the question mark and the arrows pointing out. Those are the open questions. That symbol represents open questions. These are the questions that cannot be answered by just a simple yes or no, but rather it's an open question that the patient can answer with their own words, what they're thinking, what they're feeling, right? And then we have affirmations. This means to affirm, to validate strengths, the strengths and the thoughts and ideas that the patient might have. Then we have reflection and emotional attention. Reflection is the one that looks like a mirror. That's that visual image, that's reflection. So for example, telling somebody, okay, tell me in your own words what you heard. So being able to tell somebody, tell me in your own words what you heard, tell me in your own words what you understood, or what are your takeaways from what you heard. That's what reflection means. And the emotional attention means to identify the feeling and the intensity of the feeling that this scenario might cause in the patient and how they react. Within the scenario, does the patient feel worried or anxious or confident? The purpose of these facilitation technique cards is to help empower the interviewers so that they can bring out the change from within the participants. So when using these techniques, the coaches can help the participants of the DPP to present arguments for change in 3 different ways. First, this is because we want to hear these reasons from the patient. We want to, number one, we want to have the patient verbalize their own arguments for change. We need to evoke the motivations and the words that this person has, and we need to also we need to encourage the utilization of these facilitation techniques to help push for change. And all of this is done, of course, with patience, step by step. So now we're going to play.
presentación y
And
me voy a salir a,
I'm,
a compartir
I'm going to share the presentation
mi pantalla.
and I'm going to quit sharing the presentation and go to sharing my screen. Okay, Maria, Luz is going to participate. And also, okay, so we have a couple of people who
Perfecto.
are
Y
going to
aquí
play here with me.
solamente les quiero enseñar a dónde es que pueden encontrar este
I
juego.
want to
Ustedes
show
pueden
you where you can find this game
download,
online,
descargarlo
where you
y
can
pueden
download it.
utilizarlo para sus propias
And you can use this in your own
organizaciones.
organizations.
Aquí adentro del Diabetes Resource Hub de
So at the NCFH.org website, within the Diabetes Resource Hub, you can go to Diabetes Self-Management.
Diabetes Self-Management,
And within Diabetes
hay
Self-Management,
diferentes cosas.
you're going to see several things.
Distance learning
Then click on Distance Learning.
está el Empowerment Trail Game.
And here is
Este
the
es un juego que
Empowerment
pueden
Trail
encontrar
game.
en inglés y en español, como les
You can find this game here both in
Y
English and in person, like I mentioned.
funciona
And you
Estos
can
son
play this in
cuatro
person
diferentes
or you can
formas de
play
jugar.
virtually. So there are 4 different ways to
Vamos
play.
a ir a lo que es
So we're going to go to
tablero.
the
Este es
board.
nuestro tablero de juego.
This is the game board.
Sendero del empoderamiento. Y
The road to empowerment.
vamos a comenzar a jugar.
And let's start to play.
Primero tenemos Alexis.
Alexis, who's first? The first thing we're going to do is assign the icon. See, assign an icon for each virtual player. So, for example, if we go to the, if we're going to go to the top, so let's say, if you can see where it says View Options, you're going to see an option that says Annotate, and you'll see different types of icons. There's a check mark, there's an arrow, and that's how we're going to identify each of the players. For example, I'm going to select the arrow. I'm going to choose the arrow. And you can probably see the blue arrow here. So, Maria, let's say you're the heart. So just like in any other game board, you're going to place each player's pieces at in the first square, at the starting point. From there, we're going to play with an electronic or virtual dice. There's a share for that. We're going to share a link. That with that link, you can download the electronic die to see how many spaces you're going to move forward when it's your turn. And what we're going to do here is assign your icon. Then you're going to roll your die. And this is going to assign a scenario to us. This way, the interviewer or facilitator can give us a technique to apply to that scenario.
Entonces, gracias, Alexis. Comenzamos con...
Alexis, thank you. So we're going to start with... Okay, so let's see. We're going to start with this. The die here, we get a 6. So Maria, if you want to get started.
Roll again.
Okay, so let's roll again.
Uno.
All right, 1. So here's my arrow, and I'm going to move. I'm going to move one place here. And we're going to look for that scenario that corresponds to the square where I landed. So Maria, if you will please share the different scenarios. Okay, here we go. So let's see. Healthy coping. The first one says, I have not been exercising at all. I gained 5 pounds back. I just want to give up. So then we look at the different, so now that we have the scenario, Maria will assign a technique that I need to
Perdón,
apply.
Alexis.
So,
¿Quieres
okay,
ocupar
Alexis,
afirmaciones?
do you want to use affirmations? Yes, okay, so let's use affirmations. Well, affirmation says that I'm going to choose somebody to play with to be able to develop that scenario. We're going to validate the participants' strengths, and we're going to acknowledge the challenge. And then, Maria, if you could read the scenario, please, and if you can tell us what it says.
El primer escenario sería
So the first scenarios
afrontamiento saludable. Perdón.
is here in
No
healthy
he
coping,
estado haciendo
right?
ejercicio en absoluto y
I have not been doing any
realmente
exercise. I
solo
gained back
quiero
5 pounds. I just want to give
y
up.
sí, efectivamente eh, puedo
So in fact, well, I, as the facilitator, right now, I'm using the affirmations technique. So I can say, okay, Maria, I understand that you haven't been able to exercise at all. That's totally normal. And I value the fact that you shared that with me. Now, if you've gained 5 pounds, but look, in the past, at some point, you had already gained some weight and you were able to lose some weight. So I trust you. I know that you can do this. So I want you to share with me what are those things, what are those circumstances you've gone through so that I can help you go back to realizing that same change so that you can lose some weight again, so that you can help to control your diabetes, or you can or you can reduce the risk of developing a pre-diabetes or diabetes. As you were able to see in that technique, Maria was able to present a scenario, and I applied the affirmation technique to validate the fact that the situation, validate what she shared with me, and I can tell her, look, I I affirm, I recognize, I acknowledge, I value you, and look, I know that you've done this before, and okay, so it didn't work this time, but I know that you can do it, and I can help you if you want. So these are, how this is how each of these techniques can be applied.
una voluntaria me has dicho.
Hey, you said we have a volunteer? Yes, Sylvia shared with us. Uh, Luz, if you will let us know if you're available. Yes, hello,
Sí,
good
estoy
afternoon.
disponible.
Yes, I'm available. Okay, Luz, we're going to give
Te
you,
voy a hacer estrella.
all right, so Luz is going to be a star. So then we go to the die, and we're going to roll the die. This virtual die.
Seis.
All right, 6, we got a 6. So the star icon is going to move forward 6 spaces.
Y cae en
All right, 6, and this is
estrella. En ejercicio.
okay. This is exercise. Yes, exercise. So let's look at the first exercise scenario, and Maria is going to assign a technique.
Okay. El escenario de ejercicio
So this is the scenario.
el primero que
The,
tenemos
the scenario is going to be the first one here on the screen.
estar activo después
It's
de
being
trabajar
active.
todo el día de pie.
After
No quiero
working on
hacer
your feet
ejercicio.
all day,
Prefiero
after
pasar
working on my
tiempo
feet
con
all
mis
day, I
hijos
don't want to
en su lugar.
exercise. I would rather
¿Qué
spend time with
querrías
my
hacer,
children
Luz?
where they are.
Si estarías ocupando una técnica de
So
pregunta
now,
abierta.
what would you do if you were using the open question technique? So Luz, you can see the open question technique. It says here you're going to read the scenario out loud. It's on the screen if you want to read it again. So get more information about the challenge within this scenario by asking open question to other participants. So you can use the open question techniques, maybe to ask Maria, okay, uh, how can we answer these open questions?
Pues una pregunta abierta podría
So
ser,
one open
cuéntame
question could
más
be,
acerca
well,
de qué tipo de trabajo estás
tell
haciendo.
me about the type of work that you're doing.
Claro. Pues
Sure.
fíjate, Luz, de que mi trabajo es bien pesado,
So
todo el día
Luz, let me tell
paciente.
you, it's very heavy work. I'm on my feet all day,
Estoy trabajando en recolección
and I
de
am
maíz y
harvesting
llego a
corn,
la casa muy, muy
and
cansada.
I get home very, very tired. Great. So then, Luz, during this process, then, if you want to get more information, you can ask another open question. You know that she, picks corn. You can ask her another question related to the same scenario. And this is how you can use this
Me gustaría
technique to
saber
obtain more
si
information
en
about
tu
the
caso
patient.
tienes algún tipo
Well, I'd like to know whether you have
dispositivo que te pudiera ayudar a aliviar el
some
dolor en las piernas.
some sort of device at home that can help you reduce the pain in your
Pues
legs.
sí, pudiera poner mis pies
Or,
en
you
el
know,
agua,
I could
en un balde con agua, ¿verdad?
soak my feet in a bucket of
Entiendo
water.
que pues, eso te podría ayudar y efectivamente pues
Well, I
algún
understand that
tipo
that'd be able to
pues
help
es
you,
importante
and of course
tener una
it's
herramienta también que
important
pueda ayudar
to
en ese
spend time with your
aspecto.
children. Then that'll help you
Entiendo que poner tus
emotionally,
piecitos en agua te
and
puede
also
ayudar
putting your feet
y
in
también
water
oírte
will
afirmando
also help you.
que sí, estabas bien activa a pesar de que estabas haciendo
But we've seen
proceso de
before that
trabajo.
you used to be very
Tanto
active
trabajo adicional que te
despite
puedas
always
hacer.
being doing the same type of
No,
work. Are you
no,
doing
sí,
additional work now?
sí tengo tiempo en la tarde
No, no,
para
I'm not
hacer
doing any
mis
additional
cositas
work. So
raras.
I do have time in the afternoon to be able to
Entiendo, y
do
en la
my own
mañana que es
things.
cuando estás menos cansada.
And what
Habría
about
alguna
during the
forma
morning
de utilizar un
when you're
poquito
not
más
as
de
tired?
para
Would there be a
poder
chance to do any sort of exercise
Ajá,
during the morning
sí,
hours?
pudiera en las mañanas ir cuando voy a
You
dejar a
know
mis hijos
what?
al
Yes,
colegio.
maybe in the mornings
Pudiéramos ir
when
caminando.
I drop off my children at
me
school,
deja
maybe we
saber que
could
estamos
walk to school.
ayudando de alguna forma y estamos reconociendo que
Do
sí
you know
hay
what?
una
I
herramienta con la
really
cual
enjoy the
puedes
fact that
estar más activa, te
we're
va a
looking for
ayudar
options and
y
we're
te va a
recognizing the
ayudar
fact
durante agosto.
that you can find ways to
Y
be a
en ese
little more
aspecto, pues
active.
podemos desarrollar unos minutos durante la
And
mañana
so
para que tú te sientas
maybe we
mejor.
can develop a plan for you to be able to do a
Perfecto,
little bit of
sí,
exercise in the
me
mornings.
gustaría.
Yeah, you know what? Hey, Luz, that was excellent. Yes. Okay. Luz, thank you so much for sharing with us. And thank you for participating with us. As you can tell, there are many techniques for managing these different scenarios and being able to continue to play with the game. So this is how we would do it, virtually. And we need to be able to learn how to move the pieces along the board electronically, but also in person. We can always do this in person, and maybe being able to meet someplace so that we can uh, all have a way to share this. And this is going to help everybody to understand the different scenarios, the different techniques, and so we can see more or less the way that this game is played and how these motivational interviews can be applied within this prevention program of diabetes management or self-management. So, Luz, thank you very much. So we still have a few minutes left here before we move on to the closing and the evaluation. So we want to share some resources with you. First of all, we want to thank you for participating with us, for participating in this webinar. If you have any questions, we're going to have time for Q&A right now. In a moment, you can share your questions in the chat or through the Q&A box in your Zoom platform. Okay, well, thank you very much.